ang ating lehislatura na ano man yung paraan, kung subsidiya man or dagdag na budget, kasi meron pa yung PCSO tulad nung napag-usapan kanina, ito na yung paraan para mapakita na yung sa English absorptive capacity, sa Tagalog yung kakayahang gumastos, na hindi lang basta inanunsyo na may dagdag. Salamat po kay Honorable Lino na pinunto niya nga niya, puro anunsyo pero hindi bumababa. Kasi yung anunsyo hanggang sa board yun eh. Hindi naman kami yung magpipirma ng tseke para lumabas yung pera. So yung paraan para ma-print yung tseke at lahat ng kailangan mangyari para lumabas yun at mapirmahan at lumipat na dun sa mga ospital, yun po yung kailangan magpakitang gilas na, lalo na sa darating na taon na ito.
Mr. Chair,
Yes,
Mr. Chair,
with the indulgence of Congressman Jude Sidre, the chair would like to recognize Congressman Akop.
Dr. Domingo, yung bang hinihiling ni Honorable Kimbo day-to-day activity na PhilHealth or it's part of the policy framework?
Salamat, Mr. Chair. Yung panukala po ay polisiya, pwede hong iangat sa board, pero yung computations po kung paano ang day-to-day activity.
Kaya nga, yung hinihiling niya is supposed to be of the policy framework. And pursuant to to the law you have cited, the administrative code, trabaho po yun ng board, hindi po trabaho ng PhilHealth. So that's your responsibility.
Tama po, Mr. Chair,
Yes.
yung polisiya po. Aantayin lang po namin yung datos.
Thank you, Mr. Chair.
Thank you. Congressman Jude Sidre.
Magandang hapon po, Mr. Chair. Magtatatlong oras na po tayong nagpapalitan ng katanungan at kasagutan at mas lalo ho nating naintindihan na ito pong mga tanong, mga agam-agam tungkol sa PhilHealth ay nanggagaling po sa, tawagin na lang ho natin, shared frustration. No? Frustrated po ang Kongreso kasi sa tingin po namin, napakarami yung pondo, hindi nyo maggamit ng maayos, hindi nagagastos na ma-maximize yung paggastos. Frustrated ang ating mga ospital at mga doktor kasi hindi sila nababayaran. Frustrated din ang ating mga miyembro kasi sa liit ho ng benepisyo na kanilang natatanggap compared to the premiums that they're paying. Now, I'd like to believe we're also as frustrated as they are with all the problems that you are encountering right now, because I'd like to believe these are not problems that happened overnight, no? Ang tanong ko lang, taking the cue from all the questions that been raised since kanina pa, Press Mandy, can you walk us through how PhilHealth case rates are computed? Or anybody from PhilHealth?
Mr. Chair, can I allow COO to walk you through how case rates
Yes, please.
or the case packages are computed?
Attorney
Thank you.
Eli Dino Santos.
Mr. Chairperson, Honorable Representative Asidre, when we develop packages, for example, for a given disease, what we do is conduct a consultation first with the experts. So we conduct a study, and then we determine the appropriate cost. And then after that, when all the data are available, when the analysis and evaluation had been done, the sector, the health, the HFPS will present their proposal to the Executive Committee of PhilHealth.
Attorney Santos, the whole process usually takes how many on an average?
On an average, Mr. Chairperson, Honorable Representative Asidre, it takes 1 month or 1 to 2 months.
To do the whole thing from commencing the consultations up to making the final approval of the board.
Mr. Chairperson,
Yes po.
Honorable Representative Asidre, that's only on the management side, meaning up to the Executive Committee level. Then,
And then?
it's a different timeline when we present to the Benefits Committee and then to the board. And then there's also a process of publishing the
So the whole,
circular,
Mr. Chair, the whole process from the executive committee to the benefits up to the board? How long does it take?
By my estimate, Mr. Chairperson, Honorable Representative Asidre, is from 3 to 4 months.
3 to 4 months. So when was the last time that PhilHealth, in addition to the recently made adjustments, when was the last time we made adjustments to the case rates?
Mr. Chairperson, Honorable Representative Asidre, except under the leadership of President and Chief Executive Officer Ledesma, I think it was 2012 or 2013, Mr. Chairperson, Honorable Representative Asidre, when we adjusted the case rates.
So it's 2012. Is that correct? Do you confirm, Mr. Chair?
Yes, Mr. Chairperson, Honorable Representative Asidre.
But how often is PhilHealth required to adjust the case rate? Is there a set time frame that you are required to review every so often?
Mr.
Mr. Chair?
Chairperson, Honorable Representative Asidre, insofar as I can remember the policy, it's about 3 years, Mr. Chairperson, Honorable Representative Asidre. Every 3 years, PhilHealth should review the case rates, Mr. Chairperson.
And in that case, Mr. Chair, Attorney Santos, the adjustment would have to consider inflation, the increase of healthcare costs, as well as the other expenses that a patient may incur. Is
That's
that
correct, Mr. Chairperson, Honorable Representative Asidre.
So the last time you did this was 2012, prior to the adjustments made early this year. So are you telling us, Attorney Santos, Mr. Chair, that during the entire Duterte administration, PhilHealth did not make any adjustment to the rates?
Yes, Mr. Chairperson, Honorable Representative Asidre, except on the number of dialysis sessions for a given year, we increased the same to 144, Mr. Chairperson, Honorable Representative
So the
Asidre.
policy of reviewing it every 3 years was not followed,
That's correct, Mr. Chairperson, Honorable
not even
Representative
during the
Asidre.
pandemic.
That's correct, Mr. Chairperson, Honorable Representative Asidre.
Well, kasi kung akong tatanungin nyo, Mr. Chair, Attorney Santos, no, I think this failure to adjust the case rates periodically as per policy, and if you count, it must have been at least 3 times over that period. It's one of the key reasons why we are facing all these efficiencies in PhilHealth. Would you agree, Attorney Santos?
I agree,
Chair?
Mr. Chairperson, Honorable Representative Asidre.
So if you would let me illustrate it further, Mr. Chair, assuming, no, kasi kanina we mentioned inflation, yung index natin, one of the objective index natin for calculating the case rates. So for example, kung 2012 tayo nagsimula, it's about ilang years na from now, 2024, that would be 12 years. So, conservatively, may annual inflation rate tayo na 3%. 10 years would be around 30 plus 12. That would be 36, tama ba? 36%. So kahit yung tinaas natin yun ng Pres Mandy, kinain lang ng inflation, di ba? Tama po ba?
Mr.
Yes,
Chairperson,
Mr.
Honorable
Chair.
Representative Asidre, during the time of our President, Emmanuel Ledesma Jr., we increased the case rates across the board, initially at 30%. And our President just announced earlier that the board approved the 50% increase recently, or last night, Mr. Chairperson, Honorable Representative Asidre, increasing the case rates effectively to almost 100%. I think 90+%.
Yes,
Mr.
but you are
Chairperson.
using 2014 index eh. Kaya that would have to be factored in. Kaya nga ako sinasabi ko kanina na listening to the interpellations of Congresswoman Stella Kimbo, talagang it was a failure to make the adjustments periodically on a timely basis eh.
Yes, sir.
May nagpabaya sa PhilHealth, especially in the last say 12 years na dapat ina-adjust to. Kaya nga, kung titignan mo, yung spending nyo is hindi doon kalaki at doon natin nakikita yung frustration ng mga members natin kasi